Thank you everybody for your patience as I'm giving instructions in Spanish. I really appreciate it. And we're gonna get started. I wanna be conscious of everybody's time that you guys are giving us today. So thank you so much. Today, you guys are in Ask the Expert, one of our face-to-face programming, virtual programming services. So thank you so much for joining us and giving us your time this afternoon. Oops. Sorry about that. A couple of things to know just before we get started. We are recording this session and we do that in order to share it tomorrow and the later days for people that were not able to join us tonight. So this will be posted on our YouTube channel tomorrow at the latest Monday. So give us some time and be patient as we post it and upload it to our YouTube channel. Also know that we are going to have first the questions that you guys submitted through your RSVP. So you guys were given an opportunity to submit questions ahead of time if you had them. So when we're having this conversation with Dr. Jones, we're gonna go through those questions first. We will open up the Q&A towards 15 minutes towards the end of the session where you will be able to ask additional questions just in case we didn't answer through our presentation and through the questions that you guys submitted, you will have a chance to do that. But please know that we might not have an opportunity to get to those, right? We're trying to get through the presentation and the questions that you submitted ahead of time. But if we don't, we are still working on that Q&A document that I keep saying every week. So we're still working on it. Hopefully before the weekend, we're able to upload it and share that information with you. Everybody that register, we have your emails. So we're sending out those emails with the links for the deck that we will be sharing today, as well as the YouTube channel, just so you guys can share it with your schools and other parents. And then we'll include that Q&A of questions that we didn't get to. We're going to be trying our best to answer them. But again, be patient with us. We might not be able to get to them tomorrow or over the weekend to have them up. So please just bear with us as we continue in the process of answering as many questions as possible for you guys. So thank you, and I appreciate that. Some of the next sessions that we have coming up, you guys can see them on screen. We have College and Career. We also have Chief of Information Technology and our Equity Chief that's going to be coming in February. That information will be sent to you via email. And just like you did for this session, you can click on the links and RSVP and submit questions ahead of time if you have those. And without further ado, today's speaker, we have Dr. Stephanie Jones that's joining us, Chief of Diverse Learner Support Services, or better known as ODLSS. And Dr. Stephanie is also a proud alum for Chicago Public Schools. And I'm gonna let her introduce herself a little bit more. I think she'll do more justice than me explaining where she comes from. So Dr. Jones, if you wanna introduce yourself a little bit.
Thank you, and good afternoon, everyone. Thank you, Ms. Pond, for this opportunity. As you mentioned earlier, I am a product of Chicago Public Schools. Started my elementary years here at Chicago Public Schools and ended my high school years here as I'm a graduate of Kenwood Academy. I actually started my education career here in Chicago at the Air Force Academy High School. I also supported Carver Military Academy High School. Then after that, I went outside of the district. Worked as the Director of Special Education Services for South Holland School District, and then returned here, which I'm so glad and proud to be back here in my own city.
Thank you so much, Dr. Jones. We appreciate you telling us a little bit about yourself and obviously knowing that you're part of us, right? You came from CPS and then you came back. So thank you so much for sharing that. As we get started, I'm gonna stop sharing my screen. And I think we have a short presentation that you created for us. So we're going to get that up. And then whenever you're ready, Dr. Jones.
All right, thank you. So we have several updates to provide you today regarding our plan to continue to safely reopen schools. The information that I'm sharing today was guided by questions that we have received from our diverse learner families. I would also like to review the steps we are taking to better support our diverse learners who will continue with online learning, as well as the comprehensive steps we are taking to keep students safe, students and staff safe as schools reopen. Equity is a moral imperative. It is the district, and the district is focused on equitably responding to students and families' needs during this time. As you all know, our students in pre-K and cluster programs began returning to in-person learning earlier this month on January the 11th. Our K through 8 students are scheduled to return to in-person on February the 1st, 2021. While some aspects of reopening school will be uniform across the district, such as a comprehensive health and safety protocols, daily instruction schedules for all students, whether they are learning at home or in the classroom, we have empowered our school leaders to develop their own school-specific plans because they know their communities best. Every school will have a slightly different mix of in-person and online learning based on how their families responded to the survey. A school's reopening plan begins with classroom assignments and daily schedules for their students, whether hybrid or virtual, and for our pre-K and cluster programs, a return to full in-person learning. Our schools have had to utilize flexibility in their planning, and depending on the learning preference from families that families have chosen, some students may be assigned to different homerooms and teachers than they had earlier in the school year. Moving students into another classroom will be an educator's last option, but we know our schools need that flexibility to successfully schedule classes and ensure that all children receive instruction in the form they have requested, be that in person or online. Families of our elementary school grade students should have received their schedules from schools last week. Just as we've done throughout this school year, teachers will take attendance at the beginning of each school day. For children who are learning at home, attendance will be taken at the start of real-time instruction. In addition, all students will be expected to complete and submit their assignments for grades just as they have done since the start of the school year. While our current reopening plan is focused on welcoming back our elementary school age students, we remain committed to offering our 9th through 12th graders an option for in-person learning during 2021. We have created a high school reopening task force to help direct this work. This team of school and network leaders will consider everything from safety and scheduling to opt out of school time activities and the social and emotional well-being of our high school students. Initially, this group was focused on thinking through challenges as it relates to scheduling, workforce, instructional time, safety, mental and social emotional wellness, technology, and out of school time programming. We've heard from families that their diverse learners are not being served well by online learning, and we're happy to be able to offer them an in-person option. Attendance and engagement data from our schools, our students emphasize that getting them back into the classroom is the best way to help our diverse learners reach their full potential. Here you can see suggestions for how instruction can be effectively broken down for our students during in-person learning while still keeping them safe. As you can see, our goal is to have a school day that is normal as possible, but also builds in time to teach and model new and necessary skills such as social distancing. We have also asked our educators to consider changes to the classroom environment to encourage our interactions with our virtual learners and students in the classroom. And for our diverse learners who choose to continue to learn at home, we are committed to improving their remote learning experience. Our IEP teams have been meeting to determine whether current plans can adequately meet student needs during remote learning. We have been collaborating with families around accommodations to remote learning plans that will allow our students to continue moving forward as they learn at home. If it is determined that the current IEP cannot be implemented as written during the remote learning, teams are to convene with parents to hold a remote learning plan meeting. Remote learning plans are currently embedded within the IEP and should provide all necessary accommodations needed for student success during online learning. We want our families to feel supported, especially as they navigate sending their student back to school. Over the past few months, ODLSS has hosted virtual meetings for parents and has participated in various community forums to help provide information and answer questions. This team has also created a comprehensive Q&A for families, and we recently added a form on the ODLSS homepage where parents can request assistance. And much like everything else we've done, we will continue to look for additional opportunities to engage families. Feedback from our families is critically important to us. It has led to numerous process improvements, including the use of DocuSign to save our families time filling out forms, creating a parent helpline, and developing simplified, family-friendly materials. Parents are also able to request a cloth face covering accommodation due to medical reasons for their child. The form can either be requested from the school or can be found online in the reopening guide for parents. This form needs to be completed by the parent and the medical professional. After the parent has returned the completed form into the school nurse will review and submit the information into the student information system, also known as ASPIN, and an indicator on the student's profile will indicate to school staff that the accommodation has been approved. School staff at the school and the Department of Transportation will be able to review this indicator to ensure that the students' accommodations are being followed. Students must wear a cloth face covering unless they have been approved for accommodations. Some parents have asked about support for their child if they do have an accommodation. Supports for students with cloth face covering accommodations will still be provided, and staff will continue to follow social distancing to the greatest extent possible. Notifications to parents that a student has a cloth face covering accommodation will not be utilized so as to not reveal anyone's student medical information. General notification will be shared to all parents at the school. Simultaneous instruction is an option that a school is able to implement in support of our family's choice for in-person or the learn at home model. Teachers will work to create a schedule that best meets the needs of their students. Simultaneous instruction should be accomplished through a mix of whole group, in-person and remote activities, small group activities designed by the teacher. Teachers should lead both virtual and in-person instruction utilizing the special education classroom assistant to supervise when applicable. Some classroom meetings may include opportunities for students in the learn at home model and in person to see and interact with one another. Teachers will work to ensure that all students are provided synchronous instruction to new material. This could be done simultaneously or flipped, where the student does a lesson, where the teacher does a lesson with at school students and then repeats the lesson for remote students while at school students work independently. Scheduling synchronous instruction activities, for an example, small group instruction where remote students can ask teacher questions, get live feedback and assistance on tasks they are completing, and attendance can be taken as scheduled each morning. Teachers have been provided with sample schedules to help build their planning based on what their students need in both settings. Students will continue to receive their instructional minutes as outlined in their IEP. The structure of synchronous and asynchronous may vary depending on the schedule the teacher sets up. The minimum number of synchronous minutes for students in the Learn at Home model are 60 minutes a day for pre-K, 150 minutes for K through 8. It is important to note that these are the minimum requirements, and many teachers are scheduling synchronous minutes beyond this, again, depending on the specific needs of their students. In order for minutes to be provided without students crossing pod, one recommendation is for our diverse learner teachers to push into pods and provide minutes for students in their pod whenever possible. Another solution for schools might be for them to have students go to a separate room where there are no other students except those from the same pod to receive services. Transportation. Transportation services as outlined in the student's IEP will continue to be provided. The Department of Transportation began transporting students as of January 11th for pre-K and cluster programs. Pickup and drop-off times for students will continue to be determined by the start and end times of the school schedule. The bus aides will be responsible for 2 checks with students. One check will be the student's temperature to ensure that students have a normal temperature. A second check will be a verbal check with students and or parents, if available, as to whether or not the health screener was completed. This information will be documented on a sheet that the bus aide will hand over to the school upon entry. To maintain social distancing, buses will operate at limited capacity. Social distancing will also be implemented through the use of a well-defined seating chart. Students will be seated 1 seat, alternating left and right positions. Students who reside within the same household may be seated together. Anyone boarding a school bus, including drivers and bus aides, will be required to wear a cloth face covering. If a student has a cloth face covering accommodation, it must be approved in our students' information system in order to alert the busing team of this accommodation. Utilizing CDC recommendations, cleaning guidelines, school buses will be cleaned before the start of the route, after each run, once students are dropped off, and again each night. Hand sanitizer will be available on each bus for students and staff. If a student gets sick while on the bus, on the way to school, the bus will continue to the school, who will then contact the parent to pick the student up at the school. Thank you, Ms. Pons, for giving me this opportunity to share this information with everyone.
Thank you, Dr. Jones. I think that was very helpful, a lot of info. So we're gonna let a couple minutes so it sinks in. I think it was a lot of useful information. A lot of questions I think that parents had were probably answered through your presentation. So I really appreciate that. And for parents that are listening and joining us today, we will make the deck or the presentation available for you. We'll send it out via email tomorrow, latest Monday, I promise, but you will get that email from one of my colleagues. So like I mentioned again, Dr. Jones, people were able to RSVP to join us today, and some folks were able to provide us with questions that they had ahead of time. So we're gonna start our conversation with those questions, okay, if you don't mind. So let's get started. So I have a question from a parent, Meredith, from Bell Elementary, and her question is as follows. Longer term, how will requirements be adjusted for diverse learners who were more challenged by remote learning? The example she provides is, my child earns A's and B's in school, but now it's earning A's, F's in 7th grade in remote learning. Will there be special adjustments for kids like this in the high school application process?
This year, we were able to extend the Go CPS deadline dates for high school applications to be supportive to families wanting to apply. Communications went out to all of our families on December 4th, updating them that the deadline for Go CPS, inclusive of high school applications, will be extended to January 8th of 2021. We are continuing to work collaboratively with schools and families to find ways to accommodate our students during this time.
Thank you, Dr. Jones. Sorry, I kept muting myself. Sorry, I apologize about that. Another question from the same parent, because of this urgency she feels, right, for 7th grade as they're going to be applying for high school. So her question would be, what would be the high school application standards, especially for the NWAE testing?
For some programs, we have an eligibility minimum and diverse learners need to have a combined 48 percentile in math and reading. General education students need to achieve a 24 for each. But for diverse learners, there's a small amount of flexibility in that they could have less than 24 in one subject if they score higher in the other and can get to the combined 48. If there is a specific program your child is interested, please reach out to either Go CPS at gocps@cps.edu or odlss@cps.edu for more information.
Thank you, Dr. Jones. So I think for those parents that are worried, that have more questions, thank you for giving those email addresses. So again, is gocps@cps.edu or odlss@cps.edu for those parents. We got 7 great students who are having those concerns. Thank you so much for providing that for us.
Absolutely, thank you.
Yep, the next question that we have, and I'm sorry for parents if I butcher your name, I apologize in advance. Vanessa Sanchez from Thorpe Elementary. And her question is, are there guidelines about how many mask breaks are allowed during the day for students?
Parents should work with teachers and students and the student's teacher to determine an appropriate number of mask or cloth face covering breaks during the day. We know that students returning will have different needs, and this can be best addressed in the IEP. However, teachers and parents should work together to develop a plan that best fits the individual child.
Got it. Thank you. And just to add to what you're saying, this is why in every session we keep saying it's super important for the school to have the correct contact information, right? So if there's an issue or a concern, so parents, this is a time to call the school, make sure they have your phone number, make sure they have your email address correctly, right? You guys can also visit the school's website and look for the teacher email, right? Or call the school and get that information so that you're able to have these very specific conversations with the teacher or the administrator. So thank you so much, Dr. Jones, for that. The next question is from the same parent, and it says, how are they monitoring the children that are being given these mask breaks, especially to prevent meltdowns?
What has been shared by some teachers is that they are designating a specific area clearly defined in the classroom where students are able to go when the area is clear of any other students for mask breaks. This, again, can be outlined within the student's IEP, similar to a movement break, with the number of breaks and duration if necessary.
Got it. Thank you so much. So again, it's just very important, as you keep saying these things, like to have that open communication with the teacher and the administrators at the school level. So yes. Parents, this is where you need to connect with them, make sure that you know who they are, you have their email address, and that you just have a frank conversation with them so they can share this information with you. So thank you, Dr. Jones, for that. The next question that we have is also from a parent. Again, sorry if I misstate your name, Lanika from Levy Elementary. So the question is, how does the pod look for teachers who teach multiple grade levels and the children all have various minutes for their IEP? How do we limit exposure?
Great question. For teachers with multiple grades, our guidance and teams have shared several options to support schools with planning. If students and families have selected in-person learning, we want to support students with their teacher providing instruction in person. We have first outlined for schools to look closely at their scheduling to ensure that schedules are aligned to IEP requirements, and whenever possible, keeping the same teacher with their same students. However, this may not be an option for the school for the schools. Therefore, we have shared that schools are able to schedule so that the teacher is able to push into one of the pods for live instruction, then provide remote to the students in the other classroom pods, classroom/pods. We're also asking that teachers ensure that they are providing live instruction equally to students who are in person if that option is the one that needs to be utilized, if this option is the one that needs to be utilized.
Got it. No, thank you so much. So again, I think because, right, of the process with IEPs and our kiddos, like it's really important for parents to communicate with those teachers to make sure that everything is in place and that you guys as parents, right, know what's happening. And if you have questions, you can ask those questions to the teachers of the staff that's supporting the kids. So again, super important to keep that communication line open with the school and with the teachers and with the people that are supporting our kids. So thank you so much, Dr. Jones, for that. The next question is from a parent as well, Aaliyah from Ogden. And the question is, how do we support our diverse students at home during the stressful times?
Thank you. We understand that this time is stressful to everyone, and especially for many of our diverse learner families and students during this prolonged period of time at home. There are many resources and supports available. Many times your child's teacher might be able to offer specific resources for families. Our parent involvement specialists are also available to support families and have created a quick resource list that can easily be accessed, which we'll add to the chat.
Fantastic. And thank you for that. I think sometimes as parents, we're looking for information. We don't know where to find it. So thank you for sharing that. We'll put that link in the chat and for offering like the resources specifically, right? Just for our parents who have diverse learners. I think sometimes we go online and we're searching for all this information and we can't find it. So it's really important that you guys as parents of diverse learners know where to go. So we will put those links up in the chat and then we will also email them to you guys. So you have very specific information for what you're looking for. So thank you so much for that. The next question that we have is from also a parent, Esther from Berry Elementary. She provided her question in Spanish, so I'm just going to read it in English as Manny is doing the interpretation for us. It says, how is CPS providing a quality education for diverse learners who decide to continue remote learning?
We have supported our teachers and school teams with detailed guidance on remote learning, and also our ODLSS team members, including myself, directly work with schools and their teams to support concerns and questions around remote learning to ensure that teachers and parents are able to get their questions answered. We also have developed the remote learning plan that outlines the plan for instruction during remote learning and serves as a guide for school teams. We've also provided for our cluster programs that are already in session across the district a subscription to unique curriculum so that they have another supplemental curriculum resource to utilize for with our students.
Great. So as parents if they're staying home and they have those questions again, right? Like I'm going to keep saying this. I know I sound like a broken record, guys, but communicate with the teacher so that you know what's happening. You know what supports are available. And I know some of you guys have friends in other schools and you're like, well, this school is doing this school is doing that. As Dr. Jones mentioned before, right? Like each school might be doing something different to accommodate that community. So it's really important that you guys keep in touch with your school, you know what's happening in your school, and that is to the benefit of those kiddos in your school. So I know you guys, a lot of you guys talk to each other and have friends in other schools. So again, it's really important to keep that line of communication with the teachers and the administrators at your particular school to know what's happening. So thank you, Dr. Jones, for that. The next question that we have is for, again, sorry if I mispronounce your name, Katrina from Prescott Elementary. And it says, my child has an inclusion aid and is remote. What does his aid do? Let me read that again. I'm sorry, I apologize. If my child has an inclusion aid and is remote, what does the aid do? And if she is required to be in person, who will she be able to effectively support her child?
The paraprofessional is able to support the students online with a computer in the room while the student is working with the teacher for synchronous learning and during asynchronous learning periods. The paraprofessional is able to work one-to-one with the student to support the short period of time if the parent gives their approval for this type of scenario.
Thank you. So again, I think like you keep mentioning, right? A lot of our students, because of therapy, they're very specific cases. So we can, right, compare what other schools are doing or what other kids are doing. Is really important that you as a parent communicate with the school, communicate with the teacher, and see how that's going to work out to benefit your students. So thank you again, Dr. Jones, for that. The next question that we have, it's from a community/parent, Mary, and she comes from Raise Your Hand and also from Southside Occupational. And there's a couple of questions from this particular community member. So we'll start with the first one, and it's, will parents be notified if a classmate is unable to wear a mask? If so, who will be responsible for this communication? And if not, why not?
Although we are not able to share which member of the school community has a mask of cloth face covering accommodation due to privacy and confidentiality, the laws that support this. Each school will take necessary precautions to promote health and safety of all students and staff, including maintaining social distancing and access to the approved personal protective equipment.
Okay, thank you so much for that. And thank you for sharing that. I think sometimes as parents, we want to know a lot of information and some information we can't provide. So it's great that you highlighted that because of privacy, we're not going to be able to share some of that information for particular students. So parents, keep that in mind as you're asking questions to your schools. The second question for this specific community partner says, will students taking CPS transportation be traveling in pods? If not, will students who are exposed to someone who is COVID positive need to be quarantined?
Students traveling will not be routed on CPS transportation based on their pods assigned at the school. Students on the bus will have their temperature checked, be following social distancing guidelines, and all masking requirements will remain in place. Contact tracing will be followed the same as if the student was in the school, and if necessary, there will be a need for a student to be, if necessary, there may be a need for a student to be quarantined based on the outcomes from the contact tracing.
Right, thank you. And I think as you mentioned in your presentation, there's particular protocols, right, for those kids that are taking the bus where they're being separated, that distance, one across, that we're leaving that space. So we'll share the deck with everybody so you can refresh your memory. Again, I know it's really hard to get all that information in our brain as we continue to ask the questions. And I think some of us are visual learners. So I think having that deck, right, we can take a look and absorb the information. So thank you so much for that, Dr. Jones. The other question for this particular person is, continuing with transportation, if bus drivers, bus aides, or bus mates turn up COVID positive, will parents of students who may have been exposed to the bus, on the bus, be notified? And will parents of students who may have been exposed to COVID-19 while on the CPS bus be notified? If so, who will be responsible for such notification? If not, why not?
Parents will be notified through the same process as if the student was in school. Our contact tracing team supports CPS transportation the same as they do in school contact tracing that takes place.
Thank you. So I think it's important for parents to understand that it's the same process that we're going to have if you are in the building or if you are in the bus. Because I think some of our parents have the idea it's separate. We have two separate protocols. So thank you for explaining that and clarifying that. I appreciate it. The next one, we have a question from Don. I didn't identify where Don was from. The question is, there's a lot of disparity depending on where you live in Chicago. What is being done to try and level the playing field among schools and make them more equitable in Black and Brown communities?
So one area that we're working on is through our curriculum equity initiative to have a common and culturally relevant curriculum available to all students across the district. Also, as I previously mentioned, we have recently purchased and distributed unique curriculum as a supplemental resource for all of our schools with cluster programs across the district to support with equity goals of increasing access to the general education curriculum for our diverse learners with the greatest needs. Also, we currently have an initiative to increase opportunities for our diverse learners in selective enrollment high schools. We're also working with our Office of Access and Enrollment to determine how we can increase opportunities for our diverse learners in additional programs such as career and technical education and fine arts high school programs.
Thank you, Dr. Jones. And I think for those parents, right, that especially you talked a lot about some of the high school activities and supports that you guys are trying to implement, it's really key to be, again, I sound like a broken record, but it's really key to be in the know of what's happening in your school and know who to talk to in the building. I know for some parents, sometimes that seems daunting because it's a big building and, we don't know who to talk to, but I think our administrators are super happy to talk to parents and make time for them, go in the school, our clerks, when we're able to in a safe way, right? Talk to the clerks, they'll be able to guide parents and give you those supports. So that you guys are better informed as to what's available. I know, like you said, Dr. Jones, through the different emails that you provided, right, with the ODLSS, they can also email and send questions if you if you as parents feel like you're not getting an answer, you don't know who to talk to, the last resource, right, would be to send out an email and ask those questions. And I know Dr. Jones' team is always happy to answer parents' questions. So thank you so much for that, Dr.
Absolutely.
Jones. I appreciate it.
And I also negated to mention that also the equity department is also very, plays an intricate role in regards to increasing diverse learners for selective enrollment, as well as identifying, trying to create opportunities to increase the opportunities for our CTE programs and fine arts.
Thank you. And for those folks that don't know CTE, once you guys apply for high school, there's different programs available for students, different pathways. Some high schools might have, you know, cooking or culinary arts, or have a law program. So those are different programs. I know some of our younger parents or with younger kids might be like, what's CTE? So I just wanted to clarify that out for parents. And we are going to have Dr. Sweeney join us next month. So he might be talking a little bit about that too, and just giving parents a little bit more information. So thank you for that, Dr. Jones.
Absolutely.
We're going to go to some of the questions in the chat. So bear with me. And again, guys, sorry if I butcher names. I apologize in advance. And sorry if we don't get through all the questions that you guys have posted. So let me take a look. Let me put my glasses. Sorry, guys. Looking at the screen is a little difficult for me. And I think you touched a little bit on this. There's a parent, again, with the medical exceptions, right? And please talk about how other students in the classroom would be kept safe if there's somebody in the room. So I think parents just have that concern. So if you can talk a little bit more about that, or just, you know, refresh our memory a little bit.
Oh, yes, absolutely. We're going to continue to follow and do social distancing, especially as it relates to students with and without cloth face covering accommodations, to ensure that we are practicing being very safe as possible. We also have the hand sanitizer. We have wipes. So we are making sure that we are supporting our students.
Yeah, I do have a question. I know there's a parent, and I want to ask this question here because I think it's a very personal question about a specific case. So I will send that to the parent that put it up there. I will send that to Dr. Jones' team, and then we can answer that, because I know there's very specific questions to the needs of students. And again, because we can't share some of that information, I don't want to share it, but I don't want you to think that I'm not reading your questions. So we're going to move on to another one. And this one's in Spanish, so bear with me as I read it and then try to translate it for you. So the question is, for those classrooms where, let me read it in Spanish and then I'll read it in English. It's better for me to translate, I apologize. It says, quisiera saber cuántos asistentes van a ayudar a los maestros, ya que considero va a ser complicado para los maestros trabajar con los estudiantes que están en las escuelas que necesitan más tiempo. So her question is, when students return to school, is there going to be additional support for those teachers that might need additional supports in the classrooms for those students? I'm assuming for special education students.
So for, you mean upon returning?
Yes.
Yes. So what we did for this, for the wave one, for our pre-K and cluster programs, a lot of members from central office were deployed to support schools for the first couple of weeks to support them with this in-person learning and being available. So we really kind of did an all hands on deck, and our teams went out to support our schools.
Thank you for that. And I think that's also always like a concern for parents. Is there going to be help? So thank you for clarifying that there's these additional supports that we're putting in place so that make sure that the teacher doesn't feel overwhelmed and that the students are getting the support that they need. So thank you for that. Let me see, sorry, as I'm trying to go through them, some of them are in Spanish. I'm trying to translate in my head, I apologize.
No worries.
Some of the questions, I know a parent put this question on the chat. I'm not sure that you would be able to answer this, or this would be for Dr. Fox, because it's about vaccinations and having students being vaccinated. So I don't know if that's something that you want to touch on, or that's something that Dr. Fox might be better.
I think that would be more appropriate for Dr. Fox.
Yeah. So parents, as we're having these questions, I know you're putting a lot of questions, so I'm trying to go through those. As I mentioned in other meetings, we want to make sure that you get the correct answer, not because we might not know the answer, but we want to make sure that we're getting the exact response so that you know exactly what we're going to be asking or not asking from. So for that particular question, look out for the Q&A. I know they asked Dr. Fox that too, so be on the lookout for that. So I am reading your questions. Just make sure you guys see that in the Q&A if we're able to respond. One of the questions that I do see in the chat is, how is CPS supporting early childhood diverse learners who are deaf or hard of hearing? They are too young to read the captions, I guess, if they're doing remote learning. So what are some of those supports that we're doing for those?
That's a good question. We are continuing to follow our students' IEP. And if, and I'm assuming that this is a student whose parent has opted to continue with remote learning, and that is a concern. I think this is a great opportunity for the team, inclusive of the parent, to revisit the remote learning plan to identify additional strategies that need to be implemented in order for the student to be successful.
Yeah, thank you. And I think as parents put the questions, you know, there's a lot of concerns specifically for your kiddo. So again, I think that having that communication with the teacher and your team, right? Because there's a team that revolves around making sure your kiddo's getting all of the services. It's really important to communicate with them and have like these frank conversations about how best to support the kids. So thank you so much. One of the questions, and I think, you know, when we're talking about social distancing, this is a concern that I see from a couple of the parents who put questions up, is will teachers be able to hold hands and comfort children if they have meltdowns when they're in person?
Again, we're going to continue to, we're going to practice safety. We are going to continue to follow our students' IEP. And this is definitely going to be a challenge as we do want to continue to care for our children in the same manner that we did prior.
Right.
We want to make sure that we're keeping them safe, keeping our staff safe. So there, you know, it's really going to depend on the particular classroom and the accommodations that have been outlined in the student's IEP. And it's really going to require us all, meaning parents and the schools, to really communicate and identify different strategies that have been employed during this pandemic to really make sure that we're meeting our students' needs and that we are able to be the support system that's needed. For
sure. No, and I appreciate that. I think as parents, you know, continue to think about sending their kids to school, or they are already in school for some of these kiddos, right? To, like I said, broken record here, but to have that communication, I think you pinpointed on that right now, right? Like what's included in the IEP, how can we find other ways to support our kiddos if they're having a meltdown, if there's things that we can do where we're maintaining that social distance, not only to keep our teachers safe, but also our students safe. So I appreciate that answer, Dr. Jones. Thank you. Let me continue going down this Q&A and see what we'll do. One more question. Let me see. You answered already one about the SICAs. I think we did that there. Let's see. This is something about ISB recommendations. I know you touched a little bit about that in the presentation and how you guys are following the recommendations for ISB. Can you just refresh our memory a little bit about the recommendations for how to safely reopen, that kind of stuff?
The ISB accommodations?
Mm-hmm. It says following ISB, I think that's what she meant, recommendations for getting diverse learners in school 4 days a week. So that's her question. So I don't know if, I know as we are planning reopening, we're following all the recommendations for ISB. So is there any specific information that you want to share about what you guys are following and how that, the breakdown for that?
So I partnered with the Office of School and Health and Wellness and the CEPH. We are following safety guidelines. And as explained or shared in previous board meetings and meetings with the community, where we've included experts, that can really ensure that have supported that our reopening plan is aligned in regards to from the ventilation, in regards to the appropriate PPE that we have supplied for students and staff. Really just thinking about like even to the minute of thinking about paraprofessionals that provide personal care and wanting to ensure that we have the appropriate PPE to support those exchanges. So we really were being very intentional in making sure that the guidance is covering, but as always, we're welcoming any additions that think that any from our parents, from our staff that feel like we've missed something. Again, this is new. We're all in, this is a new place for us all, and really wanted to make sure that we're answering to those families that did desire to come back to in-person, that are struggling, found that their students are not being successful with the remote learning, and wanted to make sure that there's options for everyone.
Yeah, no, thank you for that, Dr. Jones. I think as parents, as a parent myself, I think a lot of information when we're getting that, we're reading, then we're comparing and contrasting, and sometimes there's too much, right? So I think it's important, and thank you for highlighting that CPS is following those guidelines and protocols. You guys are reviewing and making sure that everything's in place for the kids to be safe, for a safe reopening of the school. So I really appreciate it. And again, for the parents, visit our website, Reopening CPS. You will have a lot of information that's available there. I know Chief Carson talked last week. You can see your own building and see what has been inspected per classroom, that kind of stuff. Dr. Fox also share information, and we'll share the information that Dr. Jones shared today. I know it's a lot as parents, right? We're trying to help our kids at home and then reading all this information, but it's out there for you guys, right? I think CPS is trying to be transparent and share all this information to make sure that, like Dr. Our CEO, said to us, right, to make the right choice for your family, right? You guys only know what's good for your kiddos and what's available for you and your family. So we want to make sure that you have this information, you're able to read it, process it, and then make the decision that's best for you and your family. So thank you, Dr. Jones, for that.
Thank you.
Yep. As we're closing down, I don't see some of the questions that we have, like I said, are for personal specific cases. So I will share those with you at a later time tomorrow, so that we're able to touch bases with those folks.
I appreciate that.
Yeah. One thing that I do want to go with you, I know we shared a lot of information. We answered a lot of questions for parents. What are some of the main things as parents might still be making their mind about sending their kids back? What are the top three things that you think are important for people to take away from today?
Great. I think one would be for parents to please, and community members, please feel free to reach out for support from our parent involvement specialists who are available to assist and can be reached. I want to provide that number. It is 773-553-1840, or their email, which is odlsspparentsupport@cps.edu. That's odlsspparentsupport@cps.edu, which we'll put that in the chat as well. I think you can also find a link on our website, on our webpage, that allows you to enter your name and contact information as a way to request more information. We know these times are difficult right now, which is why we continue to expand our options of reaching out to us to gain support. Just want to ensure that our parents know that you are not in this alone. We are here to partner with you, and we can do this together. Another is that if you have specific questions regarding your student schedule or services as school continues to prepare for in-person learning, please contact your child's school. We have ODLSS team members assigned to support each school. And if your school teams need support in answering a question, they can always feel free to reach out to us for support. And lastly, I would say that we once again are redistributing our FAQ to support our parents and school community. Please feel free to share any of your questions that you might have. We have included our questions and response in the FAQ, which will support other parents and community members who might have similar questions. And it is our expectation that this next FAQ comes out before the end of the week.
Thank you.
So look forward to that.
Oh, thank you so much. No, and I appreciate that. I think, like we said before, right, a lot of information, a lot of questions that parents still have. So thank you so much for making yourself available and making your staff available. And for our Spanish speakers, some of the parent specialists, I know we have someone who speaks Spanish, so they're able to, you can email in Spanish and somebody will be able to respond. So I know a lot of times that's with our Latino community, that's part of, like, they don't want to reach out because they don't know that and there's anybody who's going to be able to answer their question in their native language. So do know that there's somebody, one of our parent specialists who is bilingual and will be able to respond to your question or concern when you email. So just want to put that out there. Thank you so much. And I see no one else has put any more questions on the chat. And I think Ms. Parker is putting all those things in the chat with the emails, the phone numbers, the links. Parents, don't freak out and try copy and paste really fast. We will, if you can do it, great. But if not, we will send you an email tomorrow that will have all of these links and emails and phone numbers. And we will include also the deck that Dr. Jones shared with us tonight, so that you're able to take some time and just read it. And if you have questions or concerns, those are the emails that are there. You can share that information. For those questions that we were not able to answer, we will share that for the specific people that ask very specific questions. We'll share them with Dr. Jones and her team. And for the other parents that we might not be able to get to their questions, we will create that Q&A for this specific session and all the As the Expert sessions, and we'll share that with you. But like Dr. Jones said, they have their own Q&A, so go there because those questions might have already been answered. And it's just a matter of reading through those questions. So we'll share that all with you guys. By tomorrow or Monday at the latest. I know, I apologize, the last video was a little late, but we'll make sure that it's up when we're done with this one with Dr. Jones, and that you're able to share with other parents who might have the same questions you do and were not able to join us today, because I think this is important information for all of us to have. So again, parents, thank you so much for joining us and giving us your afternoon. I know it's been a busy week. You guys are getting ready to make dinner for your kiddos and help them out with homework. So I really appreciate taking the time. Dr. Jones, thank you so much for helping us and giving us your expertise and answering the questions. We really appreciate that.
Thank you, Ms. Pons, for this opportunity. Thank you to the FACE team. Chief Johnson, Deputy Chief Segura, thank you so much. Thank you, families and community members, for coming out and hearing this presentation. I hope we were able to answer some of your questions. And again, if not, please feel free to email any of us and we'll be happy to answer them. Again, looking forward to, I'm thankful for this opportunity and I'm happy that we were able to be available for our families.
No, thank you so much. And I want to send a shout out to Manny, who is doing our interpretation. Thank you so much for making this possible so that our Spanish speakers are being able to be part of this session and ask their questions too, and understand everything that Dr. Jones and I are talking about. So thank you, Manny, for doing that for us. I know our families appreciate your work. So thank you so much, everybody, and have a great night. See you next week for those that are joining us. Thank you.